Now, without any further delay, let's begin today's event. Are your employees selecting the right health plan? Sponsored by HSA Bank and hosted by Employee Benefit News and an Employee Benefit Advisor. I would like to introduce your moderator for today, and that is Lynn Gresham. Lynn, you have the floor.
Thanks very much, Jessica. Good day, everyone. We're pleased to have you with us for this web seminar. Are your employees selecting the right health plan? I'm Lynn Gresham, contributing editor with Employee Benefit News and Employee Benefit Advisor. When employees don't understand their health plan options and the factors that influence plan selection, they can end up paying more than necessary, getting insufficient coverage, or both. Ensuring your employees are well educated to make the best benefits decision will ultimately lead to more satisfied, engaged, and productive workers. Here to talk about how you can help employees evaluate health plan decisions and make a good choice is our featured speaker, Kevin Robertson, Chief Revenue Officer with HSA Bank. Kevin has more than 20 years of experience in employee benefits, insurance, and financial services. He's been exclusively focused on the consumer-directed healthcare industry for more than a decade, and he spends most of his time in Washington, D.C. working on HSA-related legislative and regulatory affairs. Kevin serves on the Healthcare Trend Institute's editorial advisory board and is a board member and compliance committee chairman of the American Bankers Association HSA Council. The council is the HSA industry's largest trade association and lobbying group. Thanks very much for taking the time to be with us today, Kevin. I'll now turn the program over to you.
Thank you so much, Lynn. It's always a pleasure being with your audience. For the participants on the call today, just take a minute and talk about what we're going to cover. We're going to go over and talk about a situation that actually affects every person enrolled or enrolling in healthcare coverage. But likely, this is simultaneously the least understood or the most often overlooked aspect of financial protection in our lives. So our discussion is going to cover first, defining the concept of choosing the right or wrong plan. And what does that mean? What factors go into that determination? Next, we're actually going to look at a few real-world examples, some actual health plan scenarios that undoubtedly we probably all have looked at before, but maybe not taken adequate time to understand the aspects of it. We'll then spend some time trying to identify the steps that employers can take to provide guidance to their employees, ultimately to help them in their individual decisions. We should have plenty of time left over for a Q&A session at the end as well, too. And this is really a great, exciting topic that is hopefully timely as we all head into the open enrollment season that probably lies before many of the groups on the call. I wouldn't be doing my job if I just didn't take a few seconds before we get started and tell you a few things about HSA Bank. Our mission is simply to empower individuals to own their own health. And through that, we empower individuals and families to make the most of every healthcare dollar. We've been focused on CDH from the beginning. Today, we serve more than 35,000 employer groups and about 2.7 million account holders. Our primary products include health savings account, flexible spending accounts, health reimbursement arrangement, COBRA administration, and commuter benefits. I'm going to turn our attention now to the presentation. And the very first thing we're going to try and tackle is answering what does it mean when we are to choose the wrong plan. There simply are many factors that go into selection of health plans. And when employees don't understand their health plan options and, quite honestly, all the factors that influence those health plan selections, they can end up making a costly mistake. Selecting the wrong plan may cause employees to pay more without getting more coverage or benefits in return. Simply stated, I think my quick definition of the wrong plan is one that either A, fails to meet the health care needs of the employee, or B, one that may actually achieve the health care needs, but that one that comes at a cost that isn't optimized for that person's circumstances. And as an employer, ensuring that your employees are well educated to make the best decision will ultimately lead to a more engaged and more productive employee. All of that can positively impact your company's bottom line. We hear from employers all the time about this topic, and quite honestly, you can actually look at some of the measurements of employer confidence or lack thereof in employee health plan choice. We actually had a recent HSA Bank survey that we asked HR executives how confident are employers that their employees understand the choices that they are making when it comes to their health insurance. And what we found as a result from this is that only 10% of employers had said that they were very confident in their employees' choice when it comes to making their health insurance decisions. 15% reported that they were not very confident or not at all confident, and about 75% were somewhat confident. So the bottom line is 90% of employers do not have confidence that their employees are making the right decision. So I would absolutely characterize this as a very important issue that we need to raise awareness for, provide assistance and help, and that's really where the genesis of this presentation came from. Because after all, a perfect situation is one where 100% of employers are confident not just in their employees' health plan elections, but also their overall health and wealth engagement. So when we talk about selecting the right plan, the focus often centers around finding an appropriate balance between cost and coverage. This really means that it's providing sufficient coverage for the unique healthcare situation of their employee and their family while balancing that with their overall costs. And of course, when you're talking about, as with any insurance coverage, selecting that health plan to find that balance is really to just generate a tolerable level of risk with given coverage and price. Now, some consumers may prefer to pay more up in front in terms to have a lower deductible or a lower out-of-pocket maximum, while others may pay less up front with a chance to have a higher deductible or higher out-of-pocket maximum. Regardless of the decision that those consumers make, our point is that this should be purposeful and educated. This balance is often solely focused on just how much premium am I paying, and I'm offsetting that with either an increased or a decreased likelihood of paying for expenses out of pocket. However, before we move on to the analysis and look at some of these scenarios, I do want to raise awareness of an issue that's often overlooked, and I call it the now or later choice. So one of the most common mistakes that people make when they're selecting plans is only to think about the right now versus the long term. In other words, for most employees and most plan determinations, they're selecting what's going to happen for the next 12 months. Well, we're advocating that, look, that is a very important component, but don't forget how this also impacts your long-term aspects, because having an understanding of both the right now as well as the long term and incorporating that into your decision may lead you down a different path. A good way to illustrate this is imagine if you were to chart out a person's lifespan, and their cumulative healthcare expenses are illustrated on this green measure. And you have ultimately every person has a choice to make. If these are their healthcare expenses, their first option is to pay them as they come in, which is represented by this blue overlay line. One of the considerations to take in your plan selection is a different alternative. You may have payment option number 2, in which case you're actually putting in money into your savings ahead of when you need it to actually flatten out that escalating cumulative expense curve in the later years. Now, I understand that this might look like we're talking about solely an HSA plan or some type of plan with the savings options, but honestly, it's not. This actually equally applies to any person's scenario, because undoubtedly the cumulative healthcare expenses and that escalation that occurs over our lifetime, that's something that every one of us is inevitably going to face. But asking people to think and perhaps act differently for in the now to impact their ability in the future is absolutely a decision point that everyone has to make, regardless if they're in a high deductible health plan paired with an HSA. So this could be just putting this money into savings or setting it aside somewhere else. It's just obviously one of the considerations to take into account is if you're doing this in an HSA, obviously it's easier and tax qualified. But I want to make sure, reiterate, this is not about an HSA versus a non-HSA plan. This problem is here and present regardless of your plan selection. So now that we've talked about not just thinking in the near term, thinking also in the long term, I do want to actually focus specifically on why the general 3 reasons why we have found employees typically choose the wrong plan. First of all is probably because of uncertainty about plan sharing amounts and their impacts. The second might be fear of high deductible or out-of-pocket maximums. Regardless of the plan selection tools, when they see big numbers, people are predisposed to think that might not be the best. And it may not be, but just to discount something or disqualify something simply because their fear of a high deductible or an out-of-pocket maximum is a mistake that they can't afford to make. And all of this should bear out if they just take time to evaluate the plan, to look at the math, to engage their individual decisions. And that's what we're advocating an employer can help do is, number one, engage employees to care enough and to take the time to properly plan. And then number 2, to think and act for the short and long term together. That's what the rest of the focus of our conversation today is going to focus on. But before we do that, I think we're at our point where we have the very first polling question. Lynn?
Yes, we are. Thanks, Kevin. We'd like your feedback on this first poll. The question is, in your opinion, what is most important to employees when selecting their health plan? Is it choice of doctors and hospitals, copay amount, coverage of specific medical services or prescriptions, low deductible or out-of-pocket maximum, total estimated annual cost of medical services, covered and out-of-pocket, or a share of the premium? We'll give it a few minutes to have the results tally because we've got a large group here today. Let's take a look at what the audience said. The lowest is copay amount at 3.2%. Choice of doctors and hospitals also came in low. On the high end, share of the premium got the most votes at 33%. Total estimated annual cost of medical services covered and out-of-pocket was 23%. Low deductible or out-of-pocket maximum was very close to that at 25%. Kevin, how does this stack up to what you usually see out there?
Yeah, actually, what you're going to see, the takeaway, regardless of how the breakdown looks, what we have found is there's clearly a lot of different opinions, and there's no strong consensus one way or another. We actually asked this same question to a group of HR executives, and again, we asked their opinion. What is the most important to employees when selecting their health plan? The most common response that we had received in that survey was 33% had said their copay amount was the most important to selecting their health plan. Honestly, when we look at and try and advocate what helps impact the best or the most important aspect is really what we call the total estimated annual cost of medical services for both covered and out-of-pocket. In other words, taking into consideration all of the things that the person could be subject to and trying to personalize that to their circumstances, we feel is the most determinative factor when selecting a health plan. Now remember that the estimated total annual costs takes into consideration the guaranteed costs that individuals will face for health care, including the premiums, but also factors in aspects of copay, deductible, out-of-pocket maximum, and all the variable costs that may or may not occur. So let me try and put some math to this, and I'm going to start by using some industry data. So this example, which is very, very common today, was looking at HDHP and PPO plans, the two most popular plans being selected today. This is actually showing industry data from the Kaiser Family Foundation HRET survey of plans, arguably one of the largest, if not the largest, plan survey publications every year. And this is the most recent data. And what we had pulled out of the Kaiser data was looking at just simply if I were to take the average annual premium and specifically the worker contribution to the premium, not the total premium. So just what the average worker in the Kaiser data was actually paying for a PPO versus a high deductible health plan. And we would look at the average annual deductible for those same HDHPs, and we have broken on the top is single coverage, on the bottom is family coverage. And then we actually factor in the average annual HSA contribution of the employers. What we found is using average data from Kaiser is that in this scenario, the PPO averages for self-only or single coverage, $171 a year less. The HDHP for family was actually less by about $844. Now, I use this simple example, and I know that this seems to make common sense. But oftentimes enrollment data shows that many people still have fear of deductibles or out-of-pocket maximums or other factors that come into consideration when picking plans. If this is true, at least on average, you would think that just looking at the math, a lot of people, especially those in family coverage, would pick a high deductible health plan. Now, when we're talking about high deductible health plans, I want to spend a moment talking about overcoming the fear because, again, looking at Kaiser data and trying to aggregate it, we found a very interesting anomaly. So if you were to look, and in 65% of the firms surveyed in the Kaiser data, the high deductible option would result in lower maximum possible spending for the employee for the year. So almost two-thirds of the time, the lower out-of-pocket option was a high deductible health plan. Roughly half the firms, the HDHP financially dominates the lower deductible option for employees. So it wasn't just a little, it was by a lot. And employees facing a range of possible medical spending distributions would save on average over $500 per year with the high deductible option, often with no additional annual financial risk. So if you take the Kaiser data and aggregate it, you'll see those three nuggets of information, which would say, man, HDHPs should dominate. Well, guess what? They're still only about 20% of the enrollment. That tells me that there is a miss in understanding of the math behind it. Leads me to another question in our second polling question. I'm going to turn it back over to Lynn if you can take it over.
Thanks, Kevin. This time we want to ask you what percentage of employees choose the same plan year after year? 45%, 68%, 82%, or 93%? Again, we'll give you a couple seconds to respond to this one. And let's see what the audience said this time. Oh, 46% said 82% and 43% at 93%. 68% tails with 10% and nobody said 45. Kevin, what's the answer?
Well, we have a very sharp audience with us today because obviously the people who are saying 93, and I'll even say 82, it's pretty close to 93, you guys are absolutely correct. According to a recent Aflac Open Enrollment Survey, they found that 93% of employees typically choose the same benefits year after year. So this tells me that my first point that I was advocating for is people aren't necessarily doing the math just because of enrollment. This reinforces that generally people just follow the path of least resistance. They're not taking the time to actually do the evaluations and say, okay, which one is best for me? Some other nuggets of information we found in there as well too, and this just again backs up the time that people simply aren't taking the time necessary to properly evaluate their plan options, is that they found 80% of employees spent less than 1 hour, and 57% of employees spent less than 30 minutes researching any options during their last enrollment session. That's across all benefit plans, so whether it was medical, dental, vision, ancillary, whatever it may be. So these are very, I would argue, very significant financial decisions, but yet the vast majority of people are not taking even 30 minutes to look at this and engage with that. So the main concept here is there's a lot of factors that go into this. The right plan provides sufficient coverage for an individual or family's unique healthcare situation while balancing cost. Yes. There's a lot of factors that go into that. Things such as co-pays and co-insurance, deductible and out-of-pocket maximum, and in-network, out-of-network, and their income, the tax savings, their ability to save. All of this seems to be a daunting task, especially when you consider you have to take all of this into the equation. You have to take into short and long-term implications. This seems like it's overwhelming. But at the same time, these decisions don't have to be overwhelming if we just, how do you eat an elephant? One bite at a time. So let's turn our attention to helping employees understand these decision points. The first thing I wanted to advocate for is education. Educate, educate, educate. Don't assume that your employees understand the terminology and vernacular as you do. We have a lot of people on the phone today that are probably HR executives. They may be advisors, consultants, a lot of different people on the phone. We probably have a deeper understanding than your average employee, and even we make mistakes. So the first thing to do is don't assume that they understand it, and help them to understand. Even simple concepts like, what exactly do we mean when we say premium, and the ramifications of that, and what is copay, and what is insurance, and what is a deductible, and what is an out-of-pocket maximum. And helping your employees understand will also help them work through the math in their given scenario. I know earlier this year we released a survey tied to our health and wealth calculator and white paper associated with that, where we actually surveyed more than 1,000 Americans and conducted a bunch of research around financial literacy and health plan costs. And what we had found is that in addition to just not understanding the terminology, in other words, the definition that I was just talking about of those terms on the earlier slide, also looking at the numbers, consumers also largely do not know what their actual plan's exposures are. 53% reported in this survey that they didn't know their copay, 47% said they didn't know what their deductible was, and 38% reported they didn't know what their maximum out-of-pocket was. I'm sorry, the exact opposite of that. So 53% said they know their copay, 47% know their deductible, and only 38% know their out-of-pocket. What this means is some fairly basic concepts around plan design, including copays and deductibles and such. The overwhelming majority of Americans in the survey did not know what those things were. So, after education and understanding, then we have to look at their gap in familiarity with knowing and estimating their medical costs as well. So when you're looking at estimating medical costs to evaluate and work through the math involved in these decisions, we advocate that an employer should help their employees ask and answer certain questions, and these questions really focus in 3 areas. Number one is, what kind of claims and expenses am I going to have? And obviously what I'm doing in this current year will probably give me an indication of what's going to happen in the future. But also then helping them understand and consider any upcoming unknown or known events. And both of those come up in terms of services of known health changes in plan services, and of course anything that might be unknown in that process. Now, a reminder that we have to remind all employees, though, is that while, yes, we have to look at our medical costs when we're taking into consideration and using the plan comparison and calculator tools that are available, is that we do not want to include, things that come at no patient cost sharing. So all of the preventative services that were covered, whether it be screenings and immunizations and, health promotion services and pregnancy and reproductive health services, whatever is included with no patient cost sharing, we want to make sure to exclude. So let's turn our attention now to actually walking through some of the math and looking at how to help your employees understand this complex situation. The one thing I want to remember and carry this through as a common thread across all of these scenarios that we're going to discuss is your best outcome is to personalize this in every way that you can. Don't just think about the straight numbers. Think about scenarios that how they relate to your employee population. Now, your given plan selections, your premiums, your contributions for workers' premiums, all of those things are factors that are determined largely by you, the employer, or in conjunction with your consultants and brokers or whoever's advising you on your plan designs and such, the carrier personnel. But make sure that you do the best job you can to look at your employee population and come up with scenarios and tools to help engage that's as closely personalized as you can. The closer connection you can get to an individual person's circumstances, the more they're going to A, care, and B, be engaged in this process. So let's look at a couple of these scenarios. Now, I know some of these scenarios are probably things that everyone on this phone has probably done before, but it's still very important to walk through because I'm going to point out a couple of common mistakes that I think, quite honestly, are overlooked. So the first case study we'd look at, of course, very common today is looking at a HDHP versus a PPO. And the scenario that we had as a mock here is, a family had 7 doctor visits, 1 child, and an ENT specialist visit. Of course, you have preventive care visits for each family members, 2 urgent care visits, and a broken arm for 1 child. Hopefully that's not the case, but we'll just pretend that actually happened. So if we were to look at the exposure to how much the HDHP plan out-of-pocket costs were versus the PPO plan, the cost of medical care may be very significantly higher on the HDHP than the PPO. In this scenario, the PPO would have been $730. The cost of medical care for the HDHP was $2,132. Right? The annual deductible factors into that, so of course the total medical expenses is significantly higher as an out-of-pocket for the PPO than the HDHP, to the tune of about $730 to $2,132. But if I look, for instance, and again walk through the math of what is my plan premiums, what are my medical expenses, if there is an employer HSA contribution, if this is an HSA qualified high deductible health plan, and then of course the tax savings associated with the HDHP. Now, with the HSA, those tax savings are using nominal tax rates, 15% federal, 7.5% FICA, and 4% as an average state income tax. Fairly nominal. Just so that in full transparency here, we are only taking a consideration of the tax savings on the expenses only. So just essentially, if you were to treat the HSA as a pass-through, and you're only funding the HSA enough to cover the expenses. So we're not adding in any additional savings if additional contributions were made. So when I take that previous scenario, which obviously was upended, $730 to $2,132, and I were to apply a total look at this, including the tax savings, the employer contribution, premium differential, that same plan generates a $2,000 or more than a $2,000 savings in the HDHP that's HSA qualified. Again, this is a very common scenario that you probably have in your own world today. I'm going to come back to some aspects of this that are probably overlooked, but before I do that, I just want to look at another case study, another example. So this is of Samantha, and this is an individual HDHP again versus a PPO. And Samantha suffered a knee injury as a result of a car accident. She received the care including an ER visit and 12 physical therapy sessions. She's also taking a brand name prescription for high cholesterol. So if you look, whatever scenarios you're going to come up with, this scenario is Samantha. Well, you have a Samantha in your population. You have a Joe. You have a Sally. You have a Bob. My point is don't just throw numbers on a screen that say, well, this is how the math works out. Try and personalize it as best you can. Try and look at your employee demographic and come up with people and scenarios and situations that actually apply to your own individual staff. So in this regard, again, comparing the PPO and the HDHP because of the cost, obviously preventative care is preventative care is covered 100%, so there's no differential there. Obviously the ER visit is potentially significantly different. The physical therapy session, same and so forth, as well as the brand name prescription. So cost of care is significantly, again, higher on the HDHP than the PPO. Not a surprise there. The annual deductible, also significantly different. Co-insurance as well too. So after looking at the total medical expenses, it's significantly higher again, between the two. If I were to again take the exact same analysis I just did on case study number 1, looking at the plan differential for premium, total medical expense, factor in employer contributions, tax savings, so on and so forth. In this scenario, there's only $349 in savings in the HSA qualified high deductible health plan, and if there was no employer HSA contribution of $800, there wouldn't be a savings. So in given scenarios, there may or may not be a savings for a PPO versus an HDHP. And this is not an attempt to be only advertising, say HDHPs are the best. They're not necessarily the best in every circumstances. Our point is that you have to do the math to determine what do we think is going to be the best for a given circumstance, balancing cost and coverage. Those determinations can only be made on an individual basis. Helping Samantha walk through and understand which might be the best for her circumstances is exactly the point. So regardless of the outcome, regardless whether it tells you it's the PPO or the HDHP or whatever type of plan you're evaluating, personalizing it and engaging people to walk through the individual circumstances is where the payoff is going to be. The last one I want to look at is this actually a little bit more complicated, but one that we're finding is very, very common today. This is actually, I pulled this data from one of our actual clients. So it's actual plan design considerations, actual premiums, actual deductibles, out-of-pocket maximums, and I want to point out something that's often overlooked. And again, this is now comparing a situation for a family HDHP versus another HDHP. Oftentimes where we see is a kind of a low deductible option and a high deductible option. So in this example, the medical expenses are exactly the same. So you have the same number of preventative care, same urgent care, prescriptions, lab tests, appendectomy. You have all of the same expenses. However, there is a significantly different deductible. The HDHP 1 carries a deductible of $3,000. The HDHP 2 carries a deductible of $5,000. And the coinsurance is the same. It's 80/20 after the deductible is being met. But because the cost of the medical expenses exceeds the deductible, there's going to be a coinsurance differential between there. So if I were to look at this and say, well, which one of these is better? Well, of course, HDHP 1, right? Because it's the lower total cost. Well, when we actually, again, look at the totality of the picture, and I look at there's a significant premium differential between the two plans. Again, the medical expenses are added in. The employer contribution is the same. The tax savings are arguably a little bit different, but even if it wasn't, the tax savings potentially, if they're max contributing, for instance, it's the same. But what you're going to find is a very significant difference between the two HSA qualified high deductible health plans. I have found an easier way of looking at this, and I know these numbers are a little small. Hopefully you can see them well on your screen, but I'll walk them through because this is probably the most common mistake I see people making when they have two HDHP options. And again, I'm making a generalization, but these are actual plan designs from a client. So if you were to look, again, HDHP 1 had a $3,000 deductible, a $6,000 maximum out-of-pocket. And HDHP, everything all being the same, was a $5,000 deductible and a $6,500 out-of-pocket maximum. Both had the same 20% coinsurance in network. All things being equal to the same plan, it's just a matter of a different deductible, different out-of-pocket maximum. They come at a different price. If you look at the average, the total premium, when you add up all the premium contribution of the employees, HDHP2 had a total premium of $24.54, and the employees' contribution for premium under HDHP1 was $43.45, a significant difference. What I'm illustrating is along the left-hand side, if you were to take total medical costs, and we try to bracket it in a common amount. So you have 250, 500,000 to up to each thousand up to 5,000, then after 10, 15, 20, 30. There's no need to go beyond 30,000 there because actually you're by the time in this scenario, by the time you hit $15,000 of actual medical costs, you've already maximized the coinsurance here. So the numbers actually, you go to $1 million, it's going to be the same exposure to the participant for that given year. Well, what this tells me is if I were to look and take into consideration how much of my costs are going to be associated with the out-of-pocket for the deductible, how much are going to be out-of-pocket for my coinsurance, the premium, the employer contribution is the same from plan to plan. It actually could be taken out of there. It doesn't really factor into this. But the bottom line is if I look at which one of these two plans is the lower cost option, there's no way a person could get hurt financially by taking the high deductible 2 option. In every single scenario, it's lower cost. I guess the worst outcome is if the person happened to fall between $5,000 and $10,000 worth of expenses, the potential savings for taking HDHP2 is going to be the lowest at $291. But if they either have a lot of medical or a little medical, their savings is going to be significantly more than this. But I'll be honest, a lot of people never take the time to do the math to see this. They only look at the $5,000 deductible and they go, oh my goodness, that's way too high. I also understand that you have to take into consideration people's individual circumstances. I get that. So, maybe it's worthwhile to pay extra premium so that they have peace of mind that they have a $3,000 versus a $5,000 deductible. Those are individual decisions, but at least our point is help them do the math. As such, again, I understand this seems all very complex, but to overcome this, there's a lot of tools at your disposals. There's plenty of online tools and calculators available to help compare health plans. And it really doesn't matter if you're getting it from your carrier, from an enrollment vendor, from a CDH administrator, wherever you're getting it. These calculations really need to be done, and they need to take into consideration all those different elements, everything from the deductible and out-of-pockets and contributions and so on and so forth. And if you don't have one, you can actually use the one that's on our website for free. It's accessible from hsabank.com/compare plans. And if you don't have one, use ours. Another aspect, and again, this all goes back to personalize. Get the participant to engage. Have them actually take the time to do the tools, whether it be a plan comparison tool, a plan selection, an HSA calculator, a CDH calculator, whatever type of plan you're trying to execute within your employee population. Do everything you can to get the participant to actually do the work to fill it out. The math does not lie. So help yourself, help them by getting them to encourage participation in those calculators. And beyond plan selection tools and plan calculators, there's also additional tools that are available on the web. For instance, obviously I talked earlier about our Health and Wealth Index Calculator, which is meant to help measure a person's individual engagement in their health and wealth. You can access that again for free, open to anyone at hsabank.com/index score. So let me put a capstone on this as we come to our near to our Q&A. If we roll all of this together, our strategy for employers to help employees make the right decision, it follows the following steps. Now, first of all, make sure that you have a defined communication plan based on your employee population. Take the time to think about your employee demographics, what you're trying to achieve, what type of outcome you're trying to drive, and layer that into your communication plan. Work collaboratively with your benefits consultant. Doesn't matter if you are working with, if you're self-funded or if you're fully insured. If you're working with a carrier, a broker, a consultant, all of the above, whatever it may be, they're great people who have the expertise and the knowledge to help you in this. Lean on your administrators, whether it be us or someone else. Lean on our expertise to help drive employees to understand this, because this is a little bit different. This has to counter that 93% that just year after year after year goes after the same plans. With hundreds of different benefit providers and varying levels of cost and coverage, the process of picking this a plan that's both cost effective and comes with that high quality, it's become incredibly specialized, and use the resources and the expertise that's out there. Start the conversation early and often on how to plan, not just at the open enrollment time, but how to continue to educate and evaluate plans as the person's needs change. What they have for needs now in their lifetime may be different next year. It might be different 5 years, 10 years, 20 years, and for sure when we get into our retirement. Help the employees make that right decision based on their circumstances, and offer, if you can, one-on-one or group time. The more that you can engage people to understand the math and apply it to their own lives and encourage employees to ask questions, the better results you're going to have. We really, as I said before, focus your education on a year-round aspect, not just looking at open enrollment, but over and over again, and encourage the employees, if nothing else, go and use one of the health plan comparison tools. Whichever tool you're utilizing, whichever calculator you're using, just take the time to do the math and understand the decision points. That's the very first step. So yes, health plan decisions are indeed complex. However, if employers just take these effective steps to simplify the process for employees, these resources are there to help employees understand that significance of their decision and how it impacts their physical and financial health. Additionally, if you'd like more information on this topic, we've actually released a new white paper entitled "Are Your Employees Selecting the Right Health Plan?" And you can download that from hsabank.com/thought leadership. So with that being said, I've been talking for about 40 minutes. We have about 15 minutes left in our program, and we want to open it up for Q&A. So Lynn, are you there?
I am here, and we do have some questions already submitted. So if you're ready, let's dive right in.
Absolutely.
Is the average annual HSA contribution on the last slide, does it include both employee and employer contributions?
So I believe the slide you were talking about was the one where I was referencing the Kaiser Family Foundation data. Their average employer contribution numbers, they publish it two different ways. They publish, and yes, it is solely employer-funded dollars, so it does not include pre-tax salary contribution, as probably everyone on this call is familiar. When you have a salary reduction agreement, so that the employees elect to do a salary reduction agreement and contribute to their HSA on a pre-tax basis through the cafeteria plan, those dollars legally become employer dollars in the process. But specific to those numbers, Kaiser reports just the employer portion, and they report the employer portion every year, or have previously, for all employers on average, including those that don't make a contribution, as well as those just making a contribution. All of that data is available if you need it. My contact information is going to be at the end of this. I can forward you that data if you'd like for more information.
Thank you. What is the percentage of employers actually contributing to the HSA? I'm not seeing a lot of contributing, so I'm curious.
So it depends. I honestly have seen fairly broad reports on this. So if you look at the Kaiser data, and so that I don't quote the wrong number while I'm talking, I'm actually going to look it up because I happen to have it fairly handy here in just a second. But I've seen it vary wildly by employer size. Generally speaking, the larger the employer, the more common it is to make a contribution. Simultaneously, the smaller the employer, generally the less common of contributions. I will tell you that more often than not, we see an employer making a contribution across our book of business, and simultaneous to that, we see more and more employers being, years ago it was very common to have seed, meaning just a flat dollar amount, employers providing, 250 single, 500 family, or 500 and 1,000, whatever the numbers may be. What we're seeing today is more and more doing a match structure or a combination thereof. But more often than not, we see people contributing, and especially once you get into the mid-size and large, the norm is to make some kind of contribution. It may not be large, but I think it's very important that employers do if they can, because psychologically, I think it helps people get over the hiccup. In addition to that, by and large, because remember, employers, if they're making contributions to planned premiums, which in most cases they are, you are in control of that. So theoretically, there's nothing wrong with, if you wanted to make a $250 contribution to the HSA, adjust, if you don't have the money to put it in there, adjust your contributions to planned premiums by $250 and have it be an offset. The same net when the day is done for the employee and the employer, but something psychologically happens when they see that the employer has skin in the game, putting money into the account. So we highly encourage that.
Okay, the next question is there a medical plan comparison calculator that can be added as a decision support tool inside our employee enrollment platform? And if so, do you have any recommendations?
That's a loaded question, and the reason is I don't know which particular platform where that question came from. I can see there's a lot of different, we'll just put it this way, there's many, many, many different enrollment platforms, many different HRS, Ben admin systems, whether you're using in-house, out-of-house, if you're using an administrator's portal, if you're not. So it's a difficult question to answer. I would tell you that the best outcome is the closest you can make it work. So in other words, all of this engagement, if you can tie it in with the technology, either at the time of a plan enrollment or account enrollment or any thereof, the better outcome you're going to have. I have seen it done many different ways, but it's kind of a difficult question to answer as written just because of everyone's circumstances are a little bit different.
All right, the next questioner says, I have many pregnant employees ask me what is the best plan. Is this a case where HDHP is not recommended?
Again, difficult to answer. In fact, the only way to answer that is to actually take the time to do the math in using one of those plan comparison tools. Because not all plans are created equal, whether it be an HDHP, PPMO, HMO, POS, whichever we're talking about, those individual circumstances are really dictated by the plan design, right? I'll give you an example. So I happen to have 3 children, including a special needs child. I hit my maximum out-of-pocket and my deductible and my maximum out-of-pocket every single year because I have a lot of healthcare needs in my particular family situation, right? I have been on an HDHP for about 12 years. never in any of my plan designs has it ever, for my circumstances, even being a high utilizer of healthcare expenses, has it made sense to go the PPO option. It's always made sense to go to the HDHP. Some years, depending on the makeup of the math, it makes more or less sense. But that's my circumstances. My point is that I'm not advocating HDHP is the right or the wrong, or the PPO is the right or the wrong, because that's an individual consideration. And the determining factor more than anything else is to do the math. And that's what we're advocating here.
Okay, next question is the analysis provided equivalent among small, mid, and large groups?
Again, it's the problem is that so many different factors go into design consideration. I will tell you that generally speaking, when you're talking about a self-funded plan, because a lot of times the employers, when they have more controls over, okay, what's the plan design, what's the plan going to pay for, this, that, the other thing, if they're an employer that's trying to structure the HDHP, to, for instance, to be more price advantageous than a PPO, it's probably going to be work out that way in the favor of the math. Is that same exact scenario going to happen in a fully insured product, regardless of small, medium, or large? It depends. But again, the point is do the math. By the way, before I forget, I told you I was going to look up the Kaiser information, and so this is actually from last year's Kaiser. The new one's not out until it's usually released in September of each year, so we won't have it for a couple more months. But the most recent data was showing that employers making, in the survey anyways, employers making an HSA contribution was 54% of family plans and 53% of single plans, so very similar. So more than half of the time employers make a contribution, but then if you actually look at the sizes of the employers, by the time you get to mid-size and above, from about 200 on up, the norm is it's very, very common that they do make a contribution.
Kevin, how do you overcome the fear of high deductible plans?
You know, I keep coming back to this, but it really is true. Math doesn't lie. Everyone, if you given a choice between something that has a low deductible and a high deductible and nothing else, which one are you going to take? Well, everyone's going to take the low deductible, right? Just because the name is a little scary. Or if you see a big number, it's scary. But when you sit people down and walk through the math, because math simply doesn't lie, is it going to be the lower cost alternative in every scenario? No, absolutely not. But the only way to determine that is to walk them through. Unfortunately, it takes a little time to do that. And, you know, an employer that has a lot of employees, and especially if you're only doing this at open enrollment time, you have to do this at all in a very condensed amount of time. So, for instance, one of the best ways to overcome this, as I've already said, is walk them through the math, but don't wait until you're right in front of your open enrollment period. There's no reason why you can't walk through and educate your employees on some of those concepts, even now, this time of the year. So we're going to be heading into the traditional, open enrollment for a 1-1 plan year. It's going to be coming up this fall. Plant your seeds now. Walk them through the concepts now if you're trying to increase your adoption later.
Are there legislative and regulatory changes that may make high deductible health plans more favorable to employees or employers?
I figured I would get this question given what's going on in the House of Representatives right now. So the answer to this is yes. There's actually quite a bit of going on. If you're not familiar or haven't heard yet of what's going on, it started, well, it's been ongoing for many years, but of recent, there was a number of bills that were marked up in the House Ways and Means Committee that were actually forwarded on and are going to be brought up to a full House floor vote tomorrow. And there's several bills that are being considered. Most of the ones that impact CDH and HSA plans are packaged into two specific plans. Those plans seek about a dozen different changes that are favorable to consumer-directed healthcare and HSA specifically. Includes some very significant proposals and things such as HSAs for working seniors that would allow people who were enrolled in Medicare A not to be able to maintain their HSA eligibility and still contribute to an HSA even though they were enrolled in Medicare Part A. It included expansion of contribution limits out of the out-of-pocket maximum, effectively doubling how much you can put in an HSA. First dollar non-preventable coverage flexibility, allowing for instance, co-pays and things to be paid that are non-preventative under the statutory minimum deductible, and a whole host of administrative changes and coordination with FSAs and everything from removing the restriction for qualified medical expenses without prescription for over-the-counter medications, just a wide-reaching list of changes. The two bill numbers, if you want to pay attention to what happens in the House, is H.R. 6311, which is called Increasing Access to Lower Premium Plans and Expanding Health Savings Account Act of 2018. That's a mouthful. And 6199, which is Restoring Access to Medication and Modernizing Health Savings Account Act of 2018. They're both separate proposals. It is widely expected to pass the House. From there, they will be sent over to the Senate, which I will tell you they face a significant uphill battle for a lot of different reasons. But if you'd like to know more, again, my contact information is at the end of this presentation. We'll share it in a second. And we will be able to keep you informed, as we do with all of our customers, what's going on. And the one thing I will ask is if you care about said provisions when it hopefully passes the House and gets sent to the Senate, is please do not hesitate to contact your legislators and ask that these things be supported. If you care about these provisions and you think that they're favorable, the best help that you can provide to your employees and to your plan is to let your legislators know that you're looking for them to support the bill.
Okay. Do you have any best practice suggestions on contributing to your 401k up to the match and then moving to an HSA to cover OOP and deductible? And are there any industry calculators that look at these choices?
So the first question is yes. This is, again, an individual circumstance that's hard to make generalizations, but I would say generally the common practice that we see, and it probably makes the most financial sense for everyone, is if you're getting a match on your 401k or if you're in a 403b or other type of defined contribution retirement plan, absolutely you should make the contribution to maximize your match. I mean, if they're matching dollar for dollar, it's 100% return with no risk. So of course, contribute to get your max. From there, it may make a lot of sense to actually go, once you've maxed out your match, to actually go fund the HSA next up to the max and then go back to the 401k after that. And the reason is simply the triple tax advantage of an HSA versus just the dual tax advantage of a defined contribution retirement plan. That's the most common that I've seen. As far as calculators, I have seen a few out there, and more are probably going to come out probably every day, every week, just because this concept around the coordination of health and wealth is becoming a very timely consideration. So absolutely, we're starting to see that as well.
Okay, we are at the top of the hour, but one more quick answer, I think. When will the new white paper from HSA Bank be available, and can you show the link again?
Sure. Let me put the link on. It's actually accessible now. There was also a press release that went out earlier today releasing this, but it's hsabank.com/thought leadership. And through there you can access this white paper, or if I mentioned earlier the white paper regarding health and wealth, a lot of this information is accessible from our main website at hsabank.com.
Okay, well, we are out of time, unfortunately. We had a lot of good questions come in that we didn't get to. HSA Bank will reach out individually to answer those questions. Also, you'll get a copy of the slides sent out with the recording and a follow-up email from EBN and EBA. I'd like to thank you all for joining us and for your participation on our polls and our question and answer session. Special thanks to Kevin for sharing his knowledge and insights with us, and to HSA Bank for sponsoring this web seminar. We hope you have a great rest of your day.
Thank you, Lynn. Thank you, audience.